The millennial health gap. Why convenience might be costing you your long-term wellness. Millennials, born 1981-1996, are redefining the healthcare landscape, prioritizing speed and digital accessibility. This generation is increasingly opting for virtual visits, urgent care clinics, and wellness apps over traditional primary care. However, medical experts are raising an alarm. This shift toward on-demand medicine may be creating a dangerous gap in preventive care. While millennials value convenience, they are also showing higher risks for chronic conditions, such as obesity and diabetes, and lower rates of routine medical checkups compared to Generation X. To bridge this gap, physicians are highlighting several critical areas where lifestyle and medical intervention must align to prevent long-term damage. The myth of invincibility. Why prevention matters. A common trend among millennials is the assumption that youth equals immunity from serious illness. This mindset often leads to the avoidance of preventive screenings, which are essential for detecting diseases like cancer early when they are most treatable. The risk: data shows rising rates of colorectal, kidney, and pancreatic cancers in this age group. The solution: instead of waiting for symptoms to appear, experts recommend creating a health calendar. This involves scheduling annual wellness visits and tracking key dates for blood work, vaccines, and screenings tailored to your specific family history and lifestyle. Establishing your health baseline without a consistent primary care provider, it is difficult to know what normal looks like for your body. The data gap: only 32% of millennial men report having a regular primary care provider, compared to 61% of Gen Xers and baby boomers. The strategy: use patient portals to download your historical lab results, blood pressure, cholesterol, etc. Having these baseline metrics allows you and your doctor to spot subtle, dangerous trends over time, rather than reacting only when a crisis occurs. The connection between mind and body. Mental health is not a separate entity from physical health. They are deeply intertwined. Chronic depression and anxiety are clinically linked to increased risks of heart disease and diabetes. Don't minimize stress. Millennials often dismiss mental health struggles as just stress. However, if symptoms persist for more than 2 weeks, they should be treated as medical concerns. Burnout is clinical. High rates of burnout driven by hustle culture are not just professional hurdles, they are medical issues linked to insomnia and chronic fatigue. Recognizing burnout as a health priority is a vital step in preventing physical collapse. Metabolic health and the silent danger. Metabolic health: how your body processes energy often declines long before physical symptoms appear. Because millennials are at a higher risk for metabolic issues, the absence of pain can lead to a false sense of security. Early intervention: regular monitoring of blood sugar and cholesterol can prevent irreversible damage, such as kidney failure or stroke, often through simple lifestyle adjustments rather than invasive procedures. Optimizing daily habits. Sleep and movement, two of the most significant pillars of health, are being neglected by this generation. The sleep deficit. Millennials are among the least likely to report getting adequate sleep. Experts describe sleep as a brain shower necessary for processing information and regulating bodily functions. Aim for at least 7 hours and limit screens and caffeine before bed. Micro habits: you don't need a total lifestyle overhaul to see results. Small, consistent changes like taking the stairs or reducing red meat consumption can significantly lower the risk of lifestyle-related cancers. Navigating the digital health trap. While wearables, smartwatches, and telehealth are revolutionary, they are tools, not replacements for professional expertise. The limitation of tech. Apps and wearables are excellent for tracking trends like activity levels, but they can be inaccurate for specific metrics like heart rate and can trigger health anxiety through constant monitoring. The virtual visit limitation. Telehealth is excellent for quick follow-ups or medication management. However, in-person visits remain essential for annual physicals and new symptoms, as doctors need to observe physical cues, such as your gait or skin texture, that a camera cannot capture. The bottom line: while digital tools and virtual care offer unprecedented convenience, they cannot replace the longitudinal care provided by a primary physician. Prioritizing preventive screenings establishing health baselines, and treating mental health as a physical priority are the most effective ways for millennials to ensure their current lifestyle doesn't dictate their future health.